Welcome, everybody. Thank you for joining us this afternoon for this University Express class. My name is Katie Earle. I'm the coordinator of the program, and I work for the Erie County Department of Senior Services. We're joined here virtually with Nikia Clark from Roswell, and I'll introduce her to you in a second. But I do want to let you know that we are recording this class, and we'll post it online at a later date. And we'll also be communicating with you through our Q&A panel. So for some of you who joined, it likely popped up on the right side of your screen. You may just have to expand it in order to see that text box. Feel free to type in your questions and comments as you think of them. At the end of the class, we'll try to get to as many questions and comments as we have time for. But don't forget to click send and make sure it goes to me, Catherine Earle, so that way we're able to answer them and I can see those questions. So I want to thank the sponsors of our program. It's my Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopedics, and Wegmans, because they help make the program possible. And if you're looking for any services for yourself or your loved one, looking to see what you qualify for, don't hesitate to give us a call at Senior Services. We're at 858-8526. And I will introduce our speaker for today. Nikia Clark is a health education specialist in the Office of Community Outreach and Engagement at Roswell Park Comprehensive Cancer Center. Nikia has over 12 years experience developing and implementing health-related curricula, trainings, presentations, and workshops. She is known for her tremendous outreach efforts and involvement in health disparities research, especially in the Western New York community. Nikia's outreach and education work focuses on breast, cervical, lung, and colorectal cancers, as well as nutrition and health behavior changes. She holds several certifications, including patient navigator and tobacco treatment specialist. And with that, I'll turn it over to Nikia. Thank you all.
Thank you. I'm so happy to be here with you and sharing in this format. And so I just thank you again for the invitation. And it is October, so happy Breast Cancer Awareness Month to all of you. And a big hello and thank you all to all of you who have been touched by breast cancer, who are survivors. You know, a special thank you and a heartfelt I admire all of you so much. So I just wanted to give you all some love this way. But we're going to start with the presentation. So this is just some breast cancer basics. And as Catherine said, if you have any questions, you can type them into the question and answer comment box. We'll do our best to get to all the questions at the end, but I also will have my contact information for you as well, so you can reach me by email or by phone, okay? And here we go. Oh. So what do we know? And breast cancer, I always start off with this slide because breast cancer has been around for a long time. You know, we can think about going years back. It's not something new. We've been researching and talking about breast cancer for many, many years. And so what do we know now in 2020? We know that breast cancer is caused by multiple things. There are ways to lower your risk. Treatment options have improved, and finding cancer early can save your life. We also know that there's some research being done with risk factors that differ for certain people by their race. And I'll talk about these throughout the presentation. So just generally, what is cancer? Cancer is the result of damaged cells that grow out of control. And on this graphic, you can see that in the top light blue box, it's normal cell division. And so the little yellow circles are normal cells. And what happens is our body is made up of those little yellow circles, and they're on every part of our body. So they're in our brain, our skin, our eyes, our breasts, our colon. Any part of your body is made up of cells. But sometimes there's something that happens to damage the cell. And that is pointed out in the kind of red, misshapen cell. And so that shows a damaged cell. Now, usually when your body is really healthy, your body is able to kill off that cell without you even knowing it was there, that it was damaged, and it doesn't cause any harm to you. And that process is called apoptosis, or cell death. And your body does that naturally. But if you look below in that darker blue box, it shows how if your body does not kill off a damaged cell, how it has the opportunity to multiply and divide. And that's when we see cancer growth, or what we know as tumors, okay? And here's just a picture of a breast anatomy. I always don't take for granted that everybody knows everything about what their body looks like. I think we have a general idea. I'm sure most of you do, but I never take that for granted. So when we talk about the breast anatomy, we include everything. It's not just the physical breast that you see that has the nipple, but you also include the lymph nodes that run up under your underarm and the side, going down the side of your body, the muscle, and the connective tissues, and also the tissue fat. So all of that area makes up the breast. Now, what are the new cases of breast cancer? So the incidence rate, and that's the new cases. And so this information was compiled back in 2016. So that's about 4 years ago. It's about the same still today. So there's an estimated 232,670 new cases of female breast cancer were diagnosed in the year of 2016. It's about the same in 2020, 4 years later. Approximately 2,360 of those new cases are male breast cancer will be diagnosed. Now, how many of you, and I can't see you all, but how many of you knew that men can get breast cancer? And you can see the difference in the amount, it's much, much, much less, a smaller group of men, but men can get breast cancer. But more white women are diagnosed with breast cancer. However, more African-American women die from it. And I'll talk about that a little bit more. And that information came from the American Cancer Society, okay? Now, what are the mortality rates? So these are the rates of death that are caused by breast cancer. And so it's an estimated that 40,000 women will die of breast cancer in 2016. That was 4 years ago. It's about the same now. And this is nationally, so in the whole United States. An estimate of 430 men will die of breast cancer in 2016. Breast cancer is the second major cause of cancer death in women. And there has been a decrease in mortality due to improved treatments and earlier detection. So that's good. So that means that women that are getting their mammograms when they're supposed to, and if they do see breast cancer, if it's present, there are new treatment options that help them live really long, happy lives. So that's a good thing. Erie County has the highest number of deaths from breast cancer in New York State for African-American women. And I do a lot of research, as Catherine talked about, I work in the Office of Community Outreach and Engagement, and a lot of my research does deal with health disparities. So I do talk about certain different populations when I'm talking about many cancers. So that's just something to note. And also breast cancer for African-American women is the #2 cause of cancer death. African-American women get breast cancer as often as white women, are more likely to get breast cancer at an earlier age. So earlier, I'm talking earlier than 40. So even in their 20s and 30s, they are more likely to have a more aggressive type of breast cancer and die of the disease. So it's very important that you never let a doctor tell you you are too young to have breast cancer, okay? Now, what are some of the risk factors? So risk factors are just, and it went too fast on me, hold on. Okay, so the risk factors are just conditions that increase your chance that cancer might occur. And so we're gonna look at 3 different types. One is heredity, and that refers to your genes that are passed down from parent to child. So that just is your family, and I'll talk about that more in depth. Your lifestyle. Some types of cancers are related to how we live and your environment. Some types of cancers are related to where we work and live, okay? So some of those risk factors are controllable. That means that there's something that we can do about it. So the controllable risk factors are your diet. You want to stay away from a diet that's high in fat and low in fiber. And on the next slide, I'll talk about that more. Obesity and weight gain, especially after menopause, is very key because it adds greatly to the risk of breast cancer. And if women that are listening now, one of the hardest places to let me back up. One of the easiest places to gain weight and the hardest places to lose weight is right in your midsection. So I'll point it on myself right here on your midsection, okay? And so that is like right around your belly button area, your midsection. And carrying weight in that midsection actually increases your risk of not only breast cancer, but also cervical cancer. It can add to high blood pressure and all different sorts of things. And so it's very important, especially after menopause. It's really, really hard to lose weight in that midsection. But you want to try. And one of the best ways to do that is through your diet. So other controllable breast cancer risk factors are your alcohol consumption. You want to be very mindful of how much alcohol you're drinking, the environment where you live in, if there's any chemicals and pollution. Some of you have had years in environments that didn't have great air quality. I know a lot of this area in Western New York, people were growing up and may have worked in manufacturing plants, Bethlehem Steel, and some of those places. And so we know that there's some links to environmental pollutions in those areas. And then also long-term smoking. Long-term smoking increases your risk, not only for breast cancer, but for all the cancers, okay? So you want to really pay attention to long-term smoking. And when I say long-term smoking, I'll clarify that it's smoking 30 years or more, okay? And so again, talking about reducing your cancer risk, you want to follow a healthy lifestyle. And that includes, and there's a new term out there, not just eating or healthy eating, now it's mindful eating. So that's a kind of a new term that's emerging, and maybe some of you have heard it, but it's really just thinking about how the food you're going to, the amount of food that you're going to eat, and what that food will really do for your body. So mindful eating, to me, sometimes, I'll think about, I love ice cream and brownies, right? So when I think about ice cream and brownies, I get happy. I get excited. So it puts me in a good mood. But I know that ice cream and brownies may not be the best for my health. So I have a couple of options. Either I'm going to go for maybe the less fun, healthy option of ice cream that's the no sugar, low fat, or substitute it with a sorbet that's fruit based, or get a smaller size of the brownie, or I will just substitute it entirely and eat something like a fruit salad or something, or maybe some trail mix that has chocolate in it. So it satisfies the craving that I want for the sweetness, but usually I will go for the brownie and ice cream. I'll just do smaller portions, okay? But mindful eating is you want to make sure you have more fruits and vegetables, less sugar, less salt, less fat, and you really look at the amount of meats that you're eating. We know that meat, although it has its nutritional benefits, you want to make sure that you're not consuming a lot of it, okay? And then next on the list is exercise. The main thing is you really want to get your heart rate up. And I know I'm talking to a lot of seniors, and so I'm not going to say, hey, and some of you may be more than able to, train for marathons or, do some really, really rigorous exercise. But you don't have to think of exercise as really being something super rigorous or something that's really going to impact, your daily schedule. You really want to just get your heart rate up to the point where if I called you on the phone and you picked up the phone and talked to me, you'd feel a little bit out of breath, okay? So you want to do something that gets your heart rate up to make you feel out of breath if you have to hold a conversation with somebody. And you should strive to exercise. The optimum would be at least 30 minutes a day, okay? Now you can break it up during the day. So you can do, 10 minutes in the morning, 10 in the afternoon, 10 in the evening. If you want to knock out 30 minutes all at one time, you can do that. Or you can do it in 5-minute increments, however you choose to do it. But that's kind of optimal. And then the last is to drink more water. And it seems so simple, but I find a lot of people have a hard time drinking water. And that's one of the really simple things that you can do to really reduce your cancer risk, is you want to drink water, because on those slides that I showed you previously about how cells work and how your body, when it's super healthy, can get rid of damaged cells. Water is that main element that helps all the functions in your body keep working, okay? It keeps them moving, keeps all the systems going. So you want to make sure your body has enough water to do that. And there's a rule of how much water you should drink. So the new rule is you should drink half your body weight in water a day. Okay, so I'll repeat that. Half your body weight in water a day. So if you're 200 pounds, you want to drink 100 fluid ounces of water a day. And you may be thinking, oh my goodness, how am I going to drink that much water? Well, you want to work yourself up to that. If you're not a water drinker, you want to work yourself up to that point. But you can get water, of course, from water, your regular bottled water that you may have in your house. But there's other sources of water. So water comes from fruits and vegetables, number one. A lot of water is found in fruits and vegetables. You can find water in your teas and coffees, but you can't add sugar. You can't add a creamer, no flavorings. It just has to be straight tea and coffee, okay, with nothing added to it. You can also get water from, clear broths that you may use for soups. So there's other ways to get water, but you really want to increase your water intake. And if you have any questions, I know some people, because of some medical restrictions, may have to talk to their doctor if they doing any of these things, changing your eating habits, exercising, or even increasing or decreasing the amount of water you take. So if it's for you individually, make sure you talk to your doctor. I always want to say that, talk to your doctor first, okay? And so there's risk factors that you can't control for breast cancer. The number one thing that you can't do anything about is getting older. The older you get, the more your risk of just cancer in general increases. And that's just how it is. As we age, we may not hear as well as we used to. We may walk a little bit slower. We may have aches and pains that weren't there before. And just as our body is going through different changes as we age, again, going back to the cells in our body, the process of that cell regeneration and having healthy cells, that starts to decline too. So doing things like exercising as much as you can, drinking the water, eating healthier, all do things in support of you making your body as healthy as possible. But that's one thing that we just can't do anything about, is getting older, having more birthdays. Your family history of breast cancer. We can't do anything about who our parents are or were, or what genes we got passed down from them. But the family history is important because cancer does, there are family connections of cancer, and that goes for all cancers across the board. So it's very important, if I'm talking to anybody that's a cancer survivor that's out there, please let your family know that you're a cancer survivor and that you've done that, and have those conversations with your daughters or grandchildren, because it's very important that they know, so they can be more prepared and they can talk to the doctor and be more assertive in their cancer care as they get older, okay? A personal history of breast cancer or benign breast lumps. In 2020, it is not uncommon to find women that are 2, 3, and sometimes 4-time breast cancer survivors. That means that they have had breast cancer 4 times, it's come back. Breast cancer does have a reoccurrence rate, okay? It's pretty moderate to high recurrence rate for some individuals. Sometimes we don't know why, and research is still being done on that, but it's not uncommon to find wonderful women that are 3 and 4-time breast cancer survivors. And then in red, that bullet in red is having multiple children, which in research is called parity, increases risk for African American women. And so there's research that has been shown that has come out in the past few years that for African American women, the more children that they have, specifically they have give birth to, the more children they have, they actually increase their risk for breast cancer. And I don't know if that may be new information to you, but on the flip side of that, we found that breastfeeding reduces their risk right back down to normal. So that is pretty awesome. When I heard that a couple of years ago, I said, oh my gosh, I never knew that. Because years ago, the research was telling us that having the more children you had would actually lower your risk of breast cancer. But that was only true for certain women in certain categories, and it really was more true for white women. But for African American women, the more children they had, it actually increased their risk for breast cancer. But if they breastfed, it would lower their risk back down to normal. So that's pretty awesome information to know and just to share. And so I just did another slide on cancer and family connection because it's just so important. We do see a lot of families here at Roswell, and but we also see people that come in and go through some of their cancer treatment by themselves, so they don't tell people, that they're going through cancer, and it could be for personal, their own personal, issues, but we do really ask that, if you're able to tell your family members, especially if it's a first degree relative, mother, father, your brother or sister or a child, that you have cancer, that you've gone through cancer treatment or you're diagnosed, it just helps them kind of map out what they need to look out for in the future and be more assertive about their health care, okay? And so also breast cancer risk factors. Now, after I told you all that information about, certain risk factors, still there's a high percentage of women, so 3 out of 4 women, or 75%, now that's really high, are diagnosed with breast cancer and they don't have any known risk factors. That means that they didn't have anything in their family. They're eating healthy, they're at a good weight, they're drinking that water, and they still get breast cancer. And so that's where a lot of the research is being done now. That's the big question mark. Well, why? And unfortunately, I can't answer that at this time, but that's why we also stress that even if you don't have any risk factors, there's still a chance that you can be diagnosed with breast cancer. So what you need to do is get your mammogram. You must get your mammogram. And I'll go into more of that later. And working in the cancer field and doing a lot of breast cancer research and talking to a lot of people, there's still a lot of myths out there. So these are all not true, but this is what I've heard. And maybe some of you have heard this too, or maybe have thought this at one point or another. But breast cancer, the first myth is breast cancer always comes in the form of a lump. And that's not true. Breast cancer can also present in the form of a rash or a bump, or again, when I showed you the picture of the breast anatomy, people just think breast cancer is right on the breast, but sometimes it's up under the armpit. So, or closer to the the center of the rib cage. So it's not always in the form of a lump. So you want to make sure that you're aware of that. Wearing an underwire bra increases your risk of getting breast cancer. That's not true. And that's, some people have heard that wearing constricting bras or with the underwire, something with the underwire, will cause you to get breast cancer, and that's not true. Exposing a tumor to air during surgery causes cancer to spread. And I've heard that a lot. And you'll hear people say, they went in to get surgery, and when they had to perform the surgery, they found cancer all throughout the body because, the air hit it and it spread. That's not true. Cancer can spread, of course. It can metastasize, and that means it can move to different areas of the body. And again, when I showed that picture of the breast, up under the arm was lymph nodes. It's part of the lymphatic system. And so that's like the body's expressway. So if a piece of the breast cancer cells break off and go through the lymph nodes and has its it has the opportunity to spread throughout the body, those cancer cells can be transplaced and put, I mean, it can go through all different, anywhere in the body. It can be the brain, the cervix, the colon. So people, you may hear people say, well, she had breast cancer and then she had cervical cancer, and then, but sometimes it's just where the breast cancer was. Some of the cells of the tumor may have entered the lymphatic system and moved to a different part of the body, okay? Wearing antiperspirant deodorant increases your risk of getting breast cancer. That's not true. However, there is information out there that certain antiperspirants and deodorants do have chemicals in them, and they may not be healthy for the body, because if you think about it, an antiperspirant is something that stops you from perspiring, right? And so it stops you from sweating. So it's actually clogging up some of your sweat glands to stop you from sweating. And we know that sweating is something, a normal body function that actually helps your body. It helps regulate body temperature, and it's something that is healthy for the body to do. And so it's really just an aesthetic thing, or people just don't like to be sweaty. So they'll use the antiperspirant deodorant. There are more natural deodorants that are out there today that you can purchase, that you can buy. There's been a movement to move away from deodorant. What I would say first, if you're doing that, you're going to try to do that, make sure you know what your body is like without deodorant, okay? You might want to ease into that. And, there's also, different natural substances that you can use in place of deodorant. But deodorant itself, antiperspirant deodorant, does not cause breast cancer, okay? A hit or injury to the breast causes breast cancer. That's not true. And breast cancer only happens to older women. That is not true. Although older women are diagnosed more with breast cancer, it is showing up in the younger population. And when I say younger, I'm talking about 40 and under, so under 40, okay? So mammograms, they are the most effective screening method to detect cancer early. So mammograms are something that we should be getting, okay? Now, what is a mammogram? And I hope all of you that are listening are at least familiar with this, but it's an X-ray picture of the breast. It detects breast cancers before they can be felt, and they detect them sooner. And the detection is much better. So when they're very, very small. Mammograms machine, they take pictures of both of the breasts. And when do you start getting mammograms? You get them at every single year, starting around 40. Okay, at the age of 40. If you have a family history, so if you have a sister that has had breast cancer or a mom that has breast cancer, you can actually start getting them 5 years earlier. Okay, so if you need to let people, your children or your grandchildren, your family, if there's a history of breast cancer, let them know, because they can go and get their mammogram earlier. And they can also see a doctor that specializes in high-risk breast cancer. So especially for African-American women, if you have a family history of breast cancer, if you've been exposed to a lot of environmental toxins growing up, if you have a long-term smoking history, you can see a doctor that actually specializes in high-risk breast cancer, okay? And breast awareness, warning signs of breast cancer. And so what I want to say before I go through these slides or these little pictures is that, remember, there's a large portion of women, 75% of women, that don't have any of these signs. They don't have any risk factors, and they don't have any signs, okay? That doesn't mean that they don't have breast cancer. But these are just some general common things that you may detect in your breast. And you can have all of these or none of these. It doesn't mean that you have breast cancer until you're diagnosed. So you have to go to a doctor, okay, to let them know. what you're experiencing. But certain things like swelling or warmth or redness or darkening of the breast, you want to keep an eye out for that. Any change in the size or shape of the breast. Now, naturally, and some women may know this, some women don't, but your breasts are not perfectly the same, okay? So one breast, the left may be a little bit bigger than the right, it may hang a little lower than the right. They're not the same. So, but if you see a really marked change in the size or shape of your breast, you want to go talk to a doctor about that. A lump or hard knot or thickening inside the breast or underarm area, that's something to talk to your doctor about. Dimpling or puckering of the skin, or itchy, scaly, sore, or rash on the nipple, talk to your doctor about that too. Pulling in of your nipple or other parts of the breast. So if you get like a kind of a dimpling, or you look at your breast and it looks like a part of it is kind of pulling in, you want to talk to your doctor about that as well. Nipple discharge that starts suddenly, or new pain in one spot that does not go away. And that pain doesn't go away with either a warm compress or a cold compress, or if you take any Tylenol, it's just a constant pain. Those are things that you want to talk to your doctor about. And also, usually when I do this presentation in person, I usually bring a breast cancer survivor with me that shares, kind of their story of how they may have found their breast cancer, or what kind of signs that they had. But again, a lot of women don't have any of this. So if you have anything going on, the best thing to do is to talk to your doctor about that, okay? And so most breast cancer has no physical signs, especially what they call a triple negative breast cancer. And triple negative breast cancer is just one of those breast cancers that is, a lot of research is being done on it now. It's just harder to treat, and it doesn't present in the normal lump. A lot of women that have triple negative breast cancer get something like a rash, that almost their breast feels like almost like an orange peel, like the outside of an orange peel. It has a rashy feel on their breast. And a lot of women may be misdiagnosed because they may think, oh, well, maybe it's the new perfume or lotion or soap that I'm wearing that just caused me, to break out, or, they don't think of anything, they don't think that it's to cause alarm or a red flag to go talk to your doctor. So what can you do to protect yourself? One is get a clinical breast exam by your nurse. And so that's when you go to your doctor's office, and a nurse will actually, with her 3 fingers, she'll do a clinical breast exam and examine your breast, okay? You also should be getting a yearly mammogram if you are 40 or older. Remember, if you're at higher risk, you can get it done at 35, but you want to get your yearly mammogram. And you want to stay aware of your breast changes, especially if you are under 40. That's very important. And even after over 40, just stay aware of them. Let your doctor know. And the picture that's on the screen is of a breast self-examination. So that's just you at home. We just always are in support of women knowing their bodies, and knowing, it's another thing of being mindful of changes going on in your body. And it's just a way you take your 1, 2, 3 fingers, and you put your arm behind your head. Many of you probably know how to do this, and men can do it too. But you just go up and down in a grid type motion. Pressing, you do like light, medium, and deep presses, just to feel if you feel anything. Now, some women have really dense breasts, so maybe some women have bigger, they're more well endowed. Some women may have cysts, in their breast, and so that can cause pain, or that can cause a lump. So you just want to make sure that whatever you're feeling, if it's anything that causes pain, it doesn't seem natural, it wasn't there, last month, last year, last week, or yesterday, talk to your doctor about it. Write it down, make a note of it, and then go talk to your doctor about it. Okay. And, oh, that was my last, I went through that fast. I usually take more time, I think, when I'm in front of people, and I usually do question and answers while I'm talking. But that was a lot of information. I hope that you learned something new, or it was just a reminder of how important it is to get screened, to share information with family, to be as healthy as you can. And just a reminder that, breast cancer, although we're still in the fight of trying to find a cure, but we've made tremendous strides. We really have. And there's, probably anywhere you turn, there's going to be a lot of pink, in this month, but there's a reason behind that. There's people behind that. That pink means something. So if you do know any breast cancer survivors, just give them a hug. Your social distance or hi. But we love them. And we just I'm always just on a mission to share information and, express the importance of getting screened. So if there's any questions, I don't know, Catherine, if you see any questions. If not, my information is there.
There are actually a couple questions, so thank
Okay.
you. And to everybody else, type in your questions and comments, and we'll try to get to those. So the first one I'm seeing is I've had 3 aunts on my mother's side who had different cancers, breast, leukemia, and uterine. What is my risk of developing cancer?
I would say actually you can talk that over with your doctor. If they're aunts, so they're not, an aunt is not your first degree relative. That's one thing. Your first degree relative would be your mother, father, sister, brother, or a child that you've had. So those are your first degree relatives. But if it's an aunt, I would just say talk it over with your doctor and let them know. Your family, I don't know if your family or if you've been interested in any genetic testing. There's options to get that done, but I would first just talk to your doctor just to assess kind of your risk assessment.
Okay, thank you for that. The next one I'm seeing is, are the signs and symptoms, I think they're referring to that picture, the same for men as well, for them to be looking for the check?
Right. So if men are experiencing any of that that was on that chart, absolutely, they can get, they need to go talk to their doctor. I believe they do, and I think it may be at ECMC, that they have a machine that does mammograms for men, but they would have to technically get like some type of ultrasound or x-ray done. They wouldn't, a lot of men can't use the typical mammogram machine a woman uses. But yes, if men are experiencing any of those signs or symptoms, they definitely need to go talk to their doctor.
Okay, thank you. The last question I'm seeing is, should I go to my primary or my gynecologist if I'm noticing something?
I would go to your gynecologist, but you can start with your primary. I know patients that have gone to either or. So I would say you can go to either one. You can go to either one.
Okay, thank you.
Mm-hmm.
Those are all the questions I'm seeing, so I could wait a couple seconds. Otherwise, we have her contact information. And again, this is recorded, so I'll post it later. Nope, just thank you so much for the information that came up.
Thank you, Catherine. Okay. It was nice to be with you all. It was great. Thank you.
Yes, I'm glad we can still do this. So thank you, very informative. Have to call for my mammogram. So there we go. All right, well, I'm going to stop recording.